Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a February 8, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County's COVID-19 new case trend line is declining, with 299 cases reported in the last 14 days. As a result, our 14-day positivity rate has decreased to 7.1%. This is great progress from the 23% rate we experienced last fall. Let's put this in perspective, however. Remember when the U.S. was having 32,000 cases per day, and we thought that was a desperate situation? Because our national case counts went up to over 300,000 per day, we've developed new thresholds or tolerance levels in our mind on what is progress in decreasing the spread, or an acceptable level of new cases. So our national case count of almost 92,000 daily, as of Saturday, February 7th, is still way higher than we want it to be. In addition to fewer cases, it is so important to keep community spread and new cases low right now. Why? Remember, spread of this virus is still too high. The B.1.1.7 variant that was detected weeks ago in the U.S. and last week in Iowa will eventually take off and increase the number of new cases and community spread. So we want our cases as low as possible before that happens. We all need to continue to wear masks and limit our interactions with others. Governor Reynolds issued a new emergency proclamation effective yesterday, Sunday, February 7th, that will lift the state's mask requirement along with the social distance and masking limitations she had in place for businesses and social gatherings. Please note, Dubuque County's mask requirement and the City of Dubuque's face covering ordinance both remain in effect. The governor's proclamation strongly encourages Iowans, businesses, and organizations to take reasonable public health measures consistent with guidance with the Iowa Department of Public Health. So Governor Reynolds is relying on Iowans, that's you, to make the right decisions and be beyond our Dubuque City and County mask requirements. We need all to make smart choices on places we shop, dine, and seek entertainment. Home is still the safest, and places that provide for physical distancing and the other public health measures is what we should focus on. One possible way we know our public health measures are working is to look at the lack of influenza circulating in Dubuque, Iowa, and the nation right now. Influenza cases are not happening, and let's hope we don't have a late influenza season this year. We don't need that on top of COVID. It could be a coincidence, but masks, hand washing, and everyone staying home when they're sick are all great ways to not spread influenza also. This week and next, we are focusing on COVID vaccinations for the pre-K through 12 school teachers and staff. Schools will begin in-person classes, all in-person classes on February 15th, so it's important to have staff and teachers protected as soon as possible. No appointments are being scheduled yet for the general public at the Kennedy Mall POD or Point of Distribution Clinic site, because we are still receiving vaccine in limited amounts. The state and federal governments will soon be allocating vaccine to a limited number of pharmacies around the state. So watch the Dubuque County Public Health Daily Updates for the latest and greatest vaccine information. So Saturday, February 6th, marked the one-year anniversary of when our Dubuque County Public Health Incident Management Team first assembled under that structure to begin dealing with COVID-19. Although we were already in discussions and doing very basic planning prior to February 6th, that's when we received our first call of needing to quarantine some Dubuque County residents who had exposure to the virus. It's not really an anniversary I want to celebrate, and I can't believe we've been dealing with this for over a year. I think we've all come to respect the power of a pandemic and know it's not something that is short-lived. About everything this virus could potentially do has happened, from causing huge number of cases and deaths, to affecting the economy and our community's livelihood, to impacting our healthcare systems like nothing has ever done before. It's influenced our social unrest and racial disparities and societal inequities. And now it's mutating and threatening much of the progress we've made in decreasing the spread. After a year, I so much value my friends, family, and coworkers more than ever before, as I'm sure many of you feel also. Not to mention social interaction. Whether it's at the coffee shop or an event, I miss being with others. But now I look to the future. Vaccinations over the next 6 months will move us in the direction of normalcy, but this is nowhere near over. And I stress to all of you to keep doing all the efforts you've been doing to slow the spread of this virus, because we're all in this together.